Good evening, good morning, and good afternoon. Depends on where in the world you're signing in from. Welcome to yet another episode of Unboxing AI. Our 25th one actually today. I am Dhruv Sahai, Chief Operating Officer at CARPL, and I will be your host for today. For those of you who are signing in for the first time, CARPL.ai is the world's largest radiology AI platform and marketplace, and the world's only with a FDA clearance and now a CE mark. The reason for our existence is fairly simple. We seek to democratize healthcare and ensure its accessibility to all. We aim to do this by ensuring that the best possible AI solutions across all use cases are available through a single medium for healthcare providers across the world in order to reduce read times and improve efficiency. Through our weekly unboxing AI webinars, we have the fortunate opportunity to speak with like minded experts from the industry and gain valuable insights from them. For today's episode, we have Mr. Ravi Ramaswamy, who has spent over 4 decades in the healthcare space and is nothing short of a legend for those who know him or of him. He has served as a senior director and head of health systems at Philips, prior to which he has also worked at GE. The list of his accolades are endless and boasts of the outstanding leaders as well as the esteemed visionaries awards. Ravi has also played an instrumental role in policy making by being an active task force member in several government committees and continues to be a valuable contributor to healthcare advancements across the globe. Over to you now, Ravi sir. Why don't you tell our viewers about yourself and your journey thus far, which I'm sure has been nothing short of epic?
Hey, Dhruv, first of all, thank you so much for hosting me on this 25th episode of yours. I always admired, and today is an opportunity for me. It's almost like a sort of a dream come true for me to be sharing my experiences and my thoughts with you and the larger audience, Dhruv. So thank you so much for you and Vidut for making this happen. Appreciate that. Uh, and the introduction has been more than what it would have really meant, but then thanks for those kind words. From my perspective, I started my career way back in 82. I always wanted to be a doctor, but then for some reason, I missed it by about a mark. So, from that perspective, medicine was always at the back of my mind, saying, some way we need to get into this and make a difference to mankind. Started off my career, as I said, in 1982 with Larsen and Toubro. I was with them for almost 19 years till 2000. And it was fortunate for me to sort of see the revolution as it happens, the electronics, the liberalization, the opening up of the Indian economy, the movement away of the license Raj and the Indian industry thriving to grow. So all that was awesome in that it was just sort of being at the right place at the right time, as I said. 20 years with L&T in various capacities, started several first in India, like the first hard disk drive manufacturing, the floppy disk drive manufacturing, printer manufacturing, the first ultrasound systems, Contron monitors, ultrasound from Contron, France again. Then we had electrosurgical instruments and ECGs with Biocardio, Biomedica. The list goes on. So cut short that, and then 20 years later, I joined GE when they wanted to set up the cardiology center in India. So went through that and spent about 10 years with them. Started off with cardiology, then I was into clinical platform development. And then I spent about 7 years as the global P&L leader for mother and child care. And that was an experience that I will never, ever forget. That taught me a lot. I was very, very reluctant to move into a GM role with that sort of responsibilities, reporting into Dr. Omar Ishraq. I knew how he runs the QBR, and I didn't want to be a guy who would get his head chopped off on the first attempt. But then survived that and traveled to about 75 odd countries, uh, understanding the dispensation of care on ground. 22 days a week, 22 days a month for 15 years, I was on living literally out of a suitcase. But then what I learned in those periods was something phenomenal. 10 years later, in 2010, I joined Philips, started off heading MR, then into running the informatics for emerging markets, and then took over as the center head in 2014. We started off with about 650 people at that time, and when I retired in 2020, we were north of 5,000. And we started from 9 businesses. We had established 33. And more important than that, Dhruv, was 50% of the global software for Philips now goes out of the campus. So that's an accomplishment that India can be proud of. Now, that was my day job, running the center. My evening job was to engage with the markets, to come up with solutions which the markets needed. Now, imagine if I had to sort of create a solution between an ultrasound, an EMR, and a cath lab, I would have to run between, say, Bothell to Blumenau in Brazil to Amsterdam. Rather than that, I had all the boys sitting under one roof at Philips, at PIC. So what we did was interact with the market and build solutions there. Now, the business always comes up with the skin in the game concept. So what we did was, we said I would go to Indonesia, understand the requirement, go to Poland, understand the requirement, and come to Singapore, understand the requirement. And you found out that it was almost like a Lego building block. 80% of it was common. But if the guys went to the business separately, they would always tell them saying that financially you guys are not viable. So what we would do is to put all the three together and create a business case, which is now a combination of 3 or 4 of these countries together. And the sweet spot was saying, go to the countries and tell them, saying, guys, if you want this product, you would never have got it from the business. Give me a part of your selects. If my amount is X, I'm only charging you X by 3 because the balance 2 by 3 comes from other countries. So in that sense, you bought the skin in the game. And on top of that, you were able to get funds and make a difference to the larger ecosystem. And the BU was very happy because they got the product, the development cost was amortized. They got it almost free of cost. So that was a model that worked really well. And that is something that we established while I was me and my team were in Philips. So overall, I think post my retirement, I've been sort of advising companies on strategy and business development and Quora and what have you. But then, yeah, it's been a busy life. I also strong evangelist for healthcare in the developed world and in the emerging markets. So, yeah, keeping myself busy and engaged and think I'm doing something productive and contribution to the decentralization of healthcare that me and you stand in for.
Wow, sir, that's quite an unbelievable journey. And the best part is you make it sound rather so simple and matter of factly, as if it's so obvious and right there. But of course, the amount of challenges that you must have faced doing this, building this, must have been phenomenal. And viewers who are attending this webinar, please feel free to ask your questions in the Q&A section, and we'll be happy to take these up as time permits. In the
Yeah, I
meantime,
do know, Dhruv, some of my colleagues are also in. So if the questions are too difficult, I will pass it on to them.
okay, that sounds like a good plan to go with. Okay, but in the meantime, sir, I had some questions for you,
Sure.
and it was more to learn from your experience, and also for our viewers to hear. I mean, to begin with, I would want to know more about, what are the challenges that you see in the healthcare space across both emerging and developed markets, and how do you feel that these need to be addressed?
Yeah, let's. I think that's a great start, Dhruv. Let's roll back time to 1978 when there was a world conference in Alma-Ata, which talked about primary care for all by 2000. 1978 to 2000, they wanted to rationalize primary care across 200 countries. They were signatory to this. Come 2025, we are still nowhere close to it. 45 years have gone and we have not seen a difference. There are 3 main challenges as they call as the iron triangle: cost, quality, and access. You look at the problem remains the same. You look at the emerged economies, or the developed world or the emerging markets. These 3 haunt it, but at different levels, so to say. If you go to the interiors of US, you will have the same problem, what you would have anywhere in India, for that matter, or in India is a great proxy to some of the other emerging markets. The situations are no different. Cost, quality, and access seems to be a common factor there that bothers everybody. Now, why is it? Simply because when you talk of cost, take, for example, US. you are at almost about 12 to 14% of your GDP goes in medical healthcare spend. Take Japan. You have a similar challenge there. You're at about 11% today, and by 2050, they expect it to go to 30% if it continues this way, because Japan has a very different problem to solve. The geriatric the population is increasing, and you find that the birth rate is on a negative. So you have got fewer people to pay for a larger care. Not only that, the average hospital per individual in a year is average is 6 days. In Japan, it is 21. So whether you look at US or whether you look at Japan, the conventional ways of infusing infrastructure into the system and making things work is not going to happen. You take India, for example. We know what the challenges are. Insurance penetration at best is at 30%. A hell of a lot of it is out-of-pocket payments. And we know that in India, you're looking at an inverted pyramid. If you look at the 830 million people in the rural area, they are served by 65,000 doctors. So if I look at the ratio of the nursing staff to 100,000 or a MR or a CT to 100,000, that ratio is always skewed. It's well below what the world averages are. So infusing funds into the system in the conventional way that what we have been doing is not going to take us anywhere. You ask Dr. Devi Shetty, he also will come and tells us in many fora that the hospital for tomorrow is going to be more like a ICU-driven hospital with the chronic care and the subacute cases being handled at home. So you see that there is going to be a complete shift in the way that healthcare is going to be dispensed in the years to come. If you look at access, we talked about, the cost of care is extremely high. Take, for example, a case of cancer. If it is detected at the first stage, the survival rate is 88%. If you go down to stage 4, the survival rate is 26%. And the spend grows exponentially upwards. And given that India and other emerging markets are more like, shall we say, out-of-pocket economies, that sort of puts a heavy drain on the individual, on the people concerned. So the question that comes up is saying, can I move from a diagnostic-based engagement to a preventive engagement? Is it possible for me to sort of look at diseases at its early stage and drive interventions rather than waiting for the disease to be manifest itself as a full-blown stuff, and then you go for the treatment there? And which also again bring back the question of saying, how many people have access to that sort of an environment where they are able to sort of pick up the disease well upfront and nip it in the bud? Take another case. Take, for example, the Middle East. All of UK has 5 genome sequencers. G42 in Dubai has 75 of them. And they have got 2 plans. They call it as a 2030 and a 2070 plans. And what do they want to do? They want to genotype the entire Emirati population so that they know what are the propensity of the diseases to come in, and is there a way that they can prevent it upfront, driving the entire country from treatment to wellness. Now, those are the far-fetched ideas that people talk about. So the way that healthcare is going to sort of manifest itself in the future is going to be completely different than the way that it has been looked at so far. And of course, there will be technologies that will go and support this. But then, yeah, the future of healthcare, the way that we see it, is significantly different than what it is today.
So, of course, I mean, the way forward as we see it is now preventive healthcare and moving, like you rightly said, moving from healthcare to wellness. I mean, prevention is better than cure, the age-old saying as it goes. So you very, rightly said that technology is what's going to, take it to that level, to the next level. And of course, I mean, it begs to ask the question, what would your thoughts be I mean, what role do you see artificial intelligence playing in healthcare? I mean, do you feel it's the knight in shining armor that we need right now, or do you see it at a stage where it has its fair share of challenges? And what could these challenges, I mean, what are these challenges?
See, the way that I look at it, exponential technologies is going to rule the roost for the future, at least for the next 2 decades. Now, what are the exponential technologies that we talk about? AI is one of them. It could be robotics. It could be prosthetics. It could be, for example, biomechanics and synthetic biology. There's a ton of shall I say, technologies, plethora of it coming together, trying to solve this massive problem. Just to give you an example, if we look at the sick patient population or the people susceptible to illness, we are looking at something like 1 billion people, adults with hypertension, about 525,000 people with diabetes, 650,000 people, 650 million people with COPD. And you're looking at, and for cancer, the question 1 in 3 will get it. It's a question of when, not will. Now, with that sort of a problem, if we have to sort of drive healthcare to the masses, and if we have to sort of come up to the vision that we talked about, I think these technologies are going to play a significant role, and AI is one of those that can help make a difference. If you look at AI, we can classify it into 2 parts. One is the clinical side of AI, and the other one is the operational side of AI. On the clinical side of AI, if we really look at it, take for example a guy who is, say, sick in outskirts of Bangalore, say 100 kilometers from Bangalore, in a place like Mandya or Chennapatna. Okay, and you're seeing that there's a cardiac event there. The expectation is that in a golden hour, you are going to get him to the hospital and get him treated. But unfortunately or fortunately, the rural areas don't have the type of expertise in terms of specialist cardiologists out there. So the question that comes up is there a way that I can take that ECG, upload it onto a system which does its analysis and gives me at least a first pass result of saying what I need to do for him? And then you can always follow that up with the next level of treatment. But at least at the first point, you are able to drive some interventions which otherwise would have been a lost case. That is one aspect of it, saying, is there a way that I will be able to diagnose at a critical juncture and take a call and then follow it up with that expert advice? Take, for example, another instance where you are placing a stent in the heart. What if you had the ability to predict what that flow is going to be, and how are you going to place that stent, and what is your roadmap, or what is your path to placing that stent is going to be well in advance before you even plan that surgery? It's going to be a lot more effective. So there are enough and more applications that one can think about where an AI can make a significant impact in terms of delivering care. That is on the clinical side. But also let's look at the operational informatics side. Take an example where I am going and registering myself for a X-ray or a CT or a MR. There is a sequence of steps that gets followed. What if the system has enough intelligence to tell both the caregiver and to me in terms of what slot do I need to pick, when do I have to go there, what are the procedures to be followed, and to the other side, tell my caregiver saying, what am I sort of allergic to? Do I have pacemakers inside? What sort of treatment can be meted out to me? So by doing so, what you're trying to do is to hasten and improve the patient experience, and also sort of reduce the time that a patient interacts with you which in turn also means you have saved money. So you look at operational informatics for driving productivity, and you look at the clinical informatics for driving, say, maybe clinical outcomes. Productivity also is a byproduct there. Like there could be a case, like, for example, I think there are systems which basically tell you or help you see areas or lesions which you would never have otherwise possibly detected. You could have as well missed it as an oversight. Now, is that going to be helpful for you? The answer is an absolute yes. So the uses are immense. The question is then the next part, which is basically, are we matured enough to rely completely on it? And there I have some views, because the system is as good as the data that you're training it on. You might train it on 10 sets, you might train it on 100 sets, 1,000 sets, 1,000,000 sets. But then a millionth and a one can be different. So the question that comes up is saying, how good is my gold sample and how well is the system trained to pick up the corner cases? And that's where you will find that the radiologist per se comes in and adds this value. While the AI in today's terms can give you an advisory, I would still possibly, I would say it is more like an AI-enabled radiologist. So the question is, how can the radiologist optimize his time in terms of what he wants to do and drive efficient and far better outcomes, which otherwise he would be sort of stretched on time to do so. There was this case that we had done in Qatar, where we were basically screening, shall I say, migrant workers for TBs. The screening was something like 2,500 people a day. Now, if I have 2,500 X-rays that I stack up with a random mix, saying some could be positive, some could be negative for TB, the typical distribution was 90% normal and 10% abnormal. So what if I ran it through an AI system by which all the abnormality would get stacked on the top, and the radiologist, when he walks into the room and opens the system the first thing in the morning, he looks at those 10% which really require his attention, the balance 90% being normal, he can sort of scan through it. So this is a case where you're saying that you're able to utilize that scarce resource for serving a much larger need of the population, at the same time driving costs down. So the role of AI is significant in terms of what you really want to do. The question is, are we prepared for embracing it the way that everybody wants it? And also remember one thing, if all the big companies were to do, take gastro as a case in point, if all the big companies were to make all the algorithms themselves, it would be simply impossible. They would require 15 to 20 years for doing all of GI alone, the algorithms for the different diseases that would actually prevail there. And that's where the startups, the new age startups comes up. And that's where you find that the need for a marketplace is so damn necessary. Each startup brings in its own capabilities, its own focus areas. And by doing so, you are able to sort of plug in applications into a platform like an orchestrator of sorts. And then you are able to sort of use the applications that are available a lot more effectively than ever before. Now, on the flip side, the question that comes up is, where are the reimbursements going to come from? Is the insurance going to reimburse all of this? There is an ethical question that comes up saying, I say that I want to give, I'll charge you X amount for doing an AI-based reading. So are we discriminating care by saying that, yes, if you afford that, you get the care. If you don't afford, then you don't get that care. So that's one view that people can bring about. The second one is, these companies, they give the algorithms and the doctor signs up on it. The risk is completely taken by the doctor, and the company does not tell the doctor how it has actually built the algorithm. So there are pros and cons, but sooner than later, just the way that we have seen in the telecom world or in the finance world, all these will get ironed out in the larger need that is driving the adoption of these technologies into the healthcare space.
Absolutely, and we are fortunate to be in the era of artificial intelligence solutions and portable X-ray machines. So we are moving in the right direction. And interestingly, you brought up the subject of reimbursements, and in fact, that was a question that I had in mind to ask you on how do you see the larger insurance companies and the looking at reimbursements for our use of artificial intelligence in healthcare, and how do you see that spectrum shaping up?
Yeah, well, see, I think they need to see proof. They need to see evidence that AI is really driving the cost down. I don't think that is yet seen. It is being seen in certain pockets, but is it across the board? The answer is no. People are still waiting and watching to see how AI actually is going to manifest itself based on the prediction models that get deployed. So I think they will have to embrace it sooner than later. Whoever thought that Aadhaar or the UPI in India is going to hit 26 billion transactions a day? So the adoption has to happen. And I think it's a question of sort of driving that conviction, saying that, yes, if you follow this path, there is going to be a result for you. There is going to be a benefit for you. I think it is going to take time, but then sooner than later, that time will be accelerated in view of the developments that are actually happening in the space.
And I mean, I covered this in our episode 20 when I spoke about regulatory concerns around use of artificial intelligence solutions. But I would love to, of course, get your viewpoint as well. With the regulatory bodies, the likes of FDA and UDAMED, TGA in Australia, how do you see them, accepting artificial intelligence solutions? I know for a fact that the FDA is actually setting up a committee of sorts to specifically look at and review, the development of AI solutions in healthcare. I mean,
The
what
very
would
fact that CARPL has its product FDA and CE certified says it all. Yeah.
so I did
The
not want to
question
make
is,
the webinar about
no,
CARPL.
it's going in that. It's not only that. I can tell you of 100 applications that the FDA has gone and certified.
Yeah,
But they are a bit cagey about it, because what happens is when you bring in something like a recursive call, where the algorithm gets modified based on the data that it reads, then you have a problem there. And that's something the FDA is worried about. If it is going to be a static algorithm, that's a lot more easier to handle, because the question that comes up is, if it does a recursive function call, and if it's going to sort of adapt itself as you go along, then what is the guarantee that the intended outcome is what you predict it to be?
absolutely.
So there are some challenges that we will, but sooner than later, I think the industry will drive it in a manner that all this will get resolved, because simply because there is no resources available or that which you can put in to sort of solve the problem that we are having in hand here.
No,
That itself will
100%
drive the
agreed.
solutions that will come out.
100% agreed, sir. And like I said, that's the magic of engaging in a conversation with you, that we don't know when and how time flies. And I just glanced at the clock, and we are out of time. So, I mean, I would love to continue longer, but maybe for another day. But I mean, wow, this has been very insightful, and I think that's all our conversations with you. I mean, once again, I'd like to thank you for making the time and doing this. And
Okay, thanks so much for this opportunity, and thanks participants for being with us. And yeah,
absolutely
we'll,
a
we'll
pleasure,
stay
sir.
connected.
And to our viewers who've signed in, thank you for joining us. And be rest assured that any questions that you've asked that we haven't been able to answer owing to time constraints, these will be answered on the link mentioned in the chat box. Do also make sure to follow our LinkedIn page and our YouTube channel for more insights. And see you next Friday at 11 a.m. Eastern Time for episode 26 of Unboxing AI.
Thank you so much, Dhruv and the team. Much
Right,
appreciated.
sir. Thank you. Pleasure.
Take care. Bye.
Bye.